forum. We've got quite a few online, so if I could ask anybody who's not speaking just to switch your cameras off, and also to put yourselves on mute. So the purpose of the forum is to bring together Imperial researchers, students and staff from all the different faculties to highlight, discuss and disseminate findings on current research and innovations on relevant global health topics. This usually takes place on a monthly basis, and this has been running for a number of years, and thank you to Nikita and to Justine for organising it. We will announce, we will be live tweeting throughout the event, and so people who are on the call today, if you want to use the Twitter hashtags IGHI Forum, and our Twitter handle is @Imperial_IGHI. In today's forum, we're going to discuss cybersecurity for healthcare, and this is from a global perspective. We've got two speakers with us today who are both brilliant. We've got Professor Deeph Chana from ISST, and we've got Nikki O'Brien, who is from IGHI, and they're going to do two different presentations. We'll have a Q&A session at the end, and please do think of some questions to ask because you'll have a great opportunity to open up the discussion. Do also use the chat function as well to pop some questions in there as you think about them, and then we'll have that discussion in the end. So in terms of cybersecurity in healthcare, the past decade has seen a surge in the use of new digital technologies across all healthcare settings. And this has led to significant improvements in the delivery of healthcare. And we've also amassed a wealth of information and data, and we're continually collecting data. And this will hopefully help shape the future of healthcare and dramatically improve outcomes globally as we collect data and help to improve the delivery of care. However, a key challenge is how to keep this data safe and secure, and to make sure that patients and the public actually trust us with all of this data collection. And this is, highly confidential about them, their families, and, there's no quicker way to undermine the public's trust than essentially allowing systems to be compromised or personal data to be lost or stolen. There's been a significant number of cyber attacks against healthcare organisations, and this has significantly increased over the past 5 years. And this is anything from, a random hacker in their bedroom to state-sponsored attacks. I think more and more it's becoming increasingly obvious that you can cause significant disruption to a healthcare organisation. And some of you may ask, what has cybersecurity got to do with healthcare and patient safety? But if you think about it, if there is any compromise on any kind of patient record, on diagnostic systems, on actually being able to treat any patients, that's either causing some kind of delay, some kind of harm, and some kind of threat to the safety of patients and the delivery of safe patient care. It's been very difficult to quantify the amount of harm and what actually happens. And this is one of the reasons why we've created a collaboration between IGHI and ISST. And it's really to fundamentally build up that academic evidence base for cybersecurity in healthcare. A very concrete example of the threat to patient care by cyber attack is that last year there was a German hospital in Düsseldorf that was closed down due to a cyber attack, or certainly they weren't admitting any patients. There was a patient who was taken by ambulance there, and they were turned away and subsequently died en route to a different hospital. And so if successfully prosecuted, this will be one of the first deaths that are directly attributable to cybersecurity. So during the COVID-19 outbreak, we've seen that cyber criminals have actually exploited the widespread fear and confusion caused by the pandemic. And we've seen a new wave of cyber attacks, and certainly right at the beginning of the pandemic, we saw lots of emails from the WHO and the CDC as spam. These were going out to lots of different people, and these organisations themselves were threatened as well. One of the major cyber attacks against healthcare was actually on the NHS itself in 2017, and that certainly exposed stark vulnerabilities within healthcare systems and the potential impact on the delivery of safe patient care. So there's huge challenges in cybersecurity planning across high, middle and low income countries, and these challenges are varied across different settings. One of the huge things has been a lack of investment and support to raise the awareness of its global importance, and also the fact that we don't really have this common language across the different settings as well. So I'm going to stop right there, and I'm going to hand over to our two speakers. Firstly, we have Professor Deeph Chana, who's currently the co-director of ISST, and also at the at the Centre for Financial Technology as well. He's been actively engaged in a number of technology entrepreneurship activities, and is also an advisor on emerging disruptive technologies to NATO as well. Professor Chana is going to talk to us about cybersecurity and the implications for global systems and infrastructure. Next, Steve.
Thanks, Saira. Hopefully you can see my screen okay. Can you confirm that? Brilliant. Okay, great. So I've been asked to talk for about 15 minutes or so, and the talk today is really going to assume you know not very much about cybersecurity, so forgive me in the early slides. We're just going to cover some very, very fundamental basics, and then really want to talk a bit more about why cybersecurity is important when we think about global systems and global infrastructure, which should hopefully then connect nicely to what Nikki is going to talk about as well with respect to healthcare systems. So, what is cybersecurity? Well, effectively, we've ended up in a world where we are shifting away from this kind of old style tool that you see on the left here, which is manually used and activated, to the kind of tools on the right hand side that are language enabled, okay, that we're able to communicate with them, and they're able to autonomously act on their own and actually take physical action in the world. And this is quite an important shift in the way human beings are interacting and using the machinery and the tools that they use. And these tools that take instructions are obviously some of the most complex things that we make today. And they receive, process, store, and disseminate data, live and breathe data, right? That's the most important thing to remember for the rest of this talk. But it's also worth remembering, I won't really come back to this later on, but it is worth remembering that this is all done by physical machines at the end of the day. So there is still a very physical element to cybersecurity, which people often forget. We are at the end of the day talking about the movement of electrons through chips and wires, and that's exactly the way in which we build our computers and our computing systems. So just before I go any further on our sort of computing infrastructure, quite often what we're interested in doing in security is trying to obviously protect certain things, and we might be trying to protect our computing systems and their data and various other aspects. And one way that we try and understand, the severity of particular threats and risks to these kind of assets, I suppose, is to consider the simple risk equation. So we might think of a particular threat or a problem that we're trying to guard against, and we try and give that thing a risk score, that threat a risk score. And the risk score is typically follows this simple formula here, where we think about the likelihood of the event, which is the L term here, and we multiply it by a term relating to the possible impact that would happen if that threat were to actually happen. And you can see very easily then from here, high likelihood and low impact risks can have a very high risk score, as can very low likelihood and high impact risks. And quite often it's this second class of problem that people ignore. The low probability, high impact risks can be very, very difficult to deal with, because probabilistically they don't happen very often, but their impacts are very, very big. And COVID-19, we might argue, is an example of one of these low likelihood, high impact risks actually coming to fruition. And when we think about traditional security models, now we maybe have some understanding of how we quantify the severity of different threats. We might want to try and protect them. And one way of doing this is to surround the things you're trying to protect, the assets that you're trying to protect, with a big wall, such as this physical fort that you can see in this slide. And this is a very useful way of doing things when you understand all of the vulnerabilities and the risks and the threats, and you understand where all your assets are. So you can draw a nice line around them, put a wall up. And as I just alluded to a minute ago, this is a very typical way in which physical security has been treated in the past. But the problems are a little bit more difficult when we talk about cybersecurity. So going back to that idea about our tools being able to have being enabled with language, what we're really seeing now is that everything is being enabled with this computing language. Everything from our hospitals, our aviation systems, our traffic management systems, and our infrastructure generally now becomes this kind of cyber-physical networked world where computers can take physical action in the world around them, and the computing systems themselves can modify the way that they act and behave based on data and information they gather from the environment around them. And this is the reason why we call this a sort of cyber-physical infrastructure. And the problem is that this cyber-physical infrastructure is becoming more complicated. We see language-enabled detectors everywhere. We see cooperating sensors and networks with coordinating computing, delivering consumer services to our home. And even in our own houses now, we see lots of control systems from our washing machines and other utilities that we might have in the house to, of course, this whole movement to working from home that we've all been forced into recently, but was a continuing trend, was a sort of, emerging trend in the years before COVID-19. And to make this really a bit more real, this is a plot that we did a few years ago with a student of mine. It's actually utilizing a search engine to search for open computing systems, and these could be computing systems in factories predominantly in this example, but computing systems around the world which still have the default passwords and admin user rights exposed as they did when they came out the factory. So these are all machines that we could log into and then effectively start getting into and sort of roam around these networks. And it's very likely that these networks themselves, or these individual computers themselves, would be interconnected with networks and systems outside of those organizations and possibly even outside of the given country that you'll see a red dot in. So we start seeing that actually this computing infrastructure is becoming increasingly interconnected at all scales. And actually, when we consider the architecture of the future, when we talk about these infrastructure systems, we can see that this interconnectivity is only set to increase. And what that does is it really starts blurring the boundaries between organizations and between assets. And if I'm running a company, for example, with a bunch of computing systems, it's no longer those computing assets that I just have to worry about. I have to worry about the connectivity to other agents and other parties that I might be working with. And it becomes very difficult to map all of that interconnectivity out. And this is a report that was written by Arup in 2013 showing the sort of architecture of a building. And here we can see just in this simple building that we have data across all of these systems. Everything starts becoming a processor. And as we see machine learning and artificial intelligence taking off as a powerful computing tool, to my mind, we move towards this idea of an artificial intelligence of things rather than just an internet of things. So things which are taking autonomous action using AI and machine learning. And in this very interconnected world, I hope if you remember the risk equation, we're quite interested to understand that if something goes wrong, what is the impact going to be? But in a sort of hyper-connected, interconnected world, if something goes wrong at one point, it becomes very difficult for us to understand how far that problem might spread. And also, because we've got so many points of entry into the system, the likelihood or understanding the likelihood of a particular threat occurring also becomes a bit ambiguous. And we suddenly have a not so simple risk equation or risk calculation to undertake. And there's lots of uncertainty around risk suddenly just because of this massive interconnectivity that we're seeing. Also, through this sort of cyber infrastructure, we've seen the emergence of novel risks and threats. One aspect which people often ignore is the idea of attribution ambiguity, and cybersecurity threats and cybersecurity attacks are actually very powerful in that not only can they create a lot of damage, but there is also an opportunity for the perpetrator to hide away or to in fact blame others for that particular attack. And this is what I mean by attribution ambiguity. There's also huge potential for misinformation and disinformation on a global scale now because of our social media networks and our communication networks. And I'm just highlighting a few examples here. TalkTalk, Sony, and Stuxnet are examples of real cyber events which have involved significant amounts of misinformation and disinformation at various scales. And of course, most recently, in the last 12 months, through COVID-19, we've seen large amounts of misinformation and disinformation regarding the virus itself. And there is, of course, a famous kind of conspiracy theory that many of you would have come across already around 5G masts and how 5G must help to spread COVID-19. So a conspiracy theory that actually brings together the physical digital infrastructure and the spread of the biological agent. I mean, very interesting. And I think maybe 12 months ago, many of us would have thought that something like that becoming a popular meme would have been very fanciful. And of course, it turns out that it's still a persistent story that's doing the rounds even as we speak. So in this digital infrastructure, there are, of course, some very, very large corporate players. There's some very large politics going on, and there's lots of money to be made and money to be exchanged. Data has become, as many people say, the new oil or the new gold. Certainly, it's a resource that can be monetized. And so cybersecurity also becomes quite a geopolitical issue as well. And here you see a picture of representing Huawei, and also the kind of tension that's existed between the United States and Huawei and other countries in Huawei, including ourselves. But it's just really to give you a flavor of the fact that it becomes very difficult to then disentangle when we're talking about genuine security issues, or when we're talking about issues such as protectionism or removal of competition and suppression. These issues are so interrelated at the moment that it becomes very difficult to see the wood from the trees as far as the truth is concerned when it comes to cyber events and cybersecurity. Going forward now, in terms of technology, I mentioned machine learning and AI. And of course, we are seeing more and more machine learning and AI being used in real world applications to create fully autonomous machines. Driverless cars are a great example of that, but really autonomy exists in many, many other places, not just with vehicles. But fully autonomous agents operating inside our critical infrastructure will deliver numerous benefits, right? There are many positive reasons for going down that road. However, it's also important to realize that machine learning and AI has the potential to both enhance security, but also to be weaponized. And there is a whole topic known as lethal autonomous weapons or laws, which is kind of debates the issue of the ethics and the possibility of machine learning and AI becoming weaponized. And actually, this is already starting to happen and is being undertaken in various quarters right now. The actual weaponization of AI and machine learning. I'm sure that won't come as too much of a surprise to people. However, what this does mean is if we have autonomous agents operating inside our infrastructure, we have to think about a different way of protecting that infrastructure. And it's likely in my mind that our cyber physical networks will much more resemble biological entities, in that we will wait for them to sort of catch infections, if you like, and we'll need to build in immunity and recovery policies rather than trying to figure out ways of creating those sort of fortress type security models that I was describing early on. I don't think it'll be tractable to have that kind of model in the future. In fact, it's not really tractable to have that kind of model today. This is just a quick video. I will pause this probably halfway through, but just an example of how machine learning and AI is also being used to drive misinformation and the so-called idea of deep fakes. This is actually a fake video of ex-President Barack Obama. A University of Washington researchers a few years ago demonstrated an ability to create this whole fake piece of footage of Barack Obama using a generative adversarial neural net approach to train to effectively create a piece of software that could replicate the president's face and actually then be voiced over live. And this is really the beginning of what we kind of see a very important movement in misinformation and kind of deep fakes, which will have severe ramifications in the future when we talk about cybersecurity across all different application spaces, including health, I'm sure. And just to finish on the last few slides, I'd like to talk about some of the regulatory conundrums this causes to people who have to worry about these kind of things. So a few years ago, some of you will remember that Apple told the FBI that they would not help them unlock one of their mobile phones in response to an FBI terrorist investigation. And at that time, this really raised some serious questions amongst regulators around the world on digital systems and technologies. And really, some of these questions have never really been answered. Regulators are very concerned about whether or not they can be confident that technology developers understand how to keep the technology under control. But when they examine this question a bit further, they realize that they don't really know what they mean when they say they want those technology innovators to keep the technology under control. And regulators are also very, very concerned that if they over-regulate the digital space in terms of security, that they could hurt the economy because they could stifle progress and innovation in their own economy. And so inaction quite often results, especially when we talk about things like cybersecurity, because of this kind of regulatory fear that innovation might be stifled. There are also big debates around exactly what the data deal is between individual citizens, organizations, and governments. Who should see what? Who can trust? Can you trust your employer? Can you trust the health service? Can you trust big government? And at the moment, this idea about who trusts who in this kind of in this ecosystem, and what data should be exchanged and who should have control over that data exchange is currently something which, again, people don't have a clear answer to in many sort of digital applications and industries. The last point I'd like to make is that this is a graph from a few years ago from an organization called World Mapper. It's probably a little bit out of date now, but the main point here is that this graph shows the World Bank data on world poverty. And really, one of the other things that we're noticing, a big geopolitical issue that we're noticing in terms of cyber and in terms of data, is that there is a very, very powerful chance, or a good chance, that by keeping and controlling data in certain geographic locales, that we will create the conditions for a new kind of poverty, which will, of course, be poverty or data poverty. The inability to have access and to actually create an economy out of data, because that data does not necessarily reside in your country or is under your control. You don't necessarily have access to it. So I'll just end by saying that overall, when we look at cybersecurity and we look at digital systems, the next generation of technology could either accelerate the pace of equality of opportunity globally, or really set it back another 100 years. And in my mind, we must really aim for the former. And security and insecurity is something that needs to be considered at a global scale, not just at a local scale. And I think that point is not more poignant in any other sphere than it is in health and healthcare systems. So, Saira, I will stop at that and let you hand over to somebody else. I guess Nikki next.
Thank you so much. That was brilliant, and just all the different topics that you covered within that talk. I'm sure there's going to be lots of questions at the end. I'll now hand over to Nikki. Nikki is a policy fellow at the Institute of Global Health Innovation and works on cybersecurity and also the value of healthcare data. Nikki's been instrumental in one of her big research pieces, and she will tell us all more about it. And it's basically developing a global framework for cybersecurity scale up in healthcare organisations. So I will hand over to Nikki.
Thanks, Saira, and thanks, Deeph, for a really interesting introduction to cybersecurity. As Saira said, I'm Nikki O'Brien, and I'm a policy fellow in global health at IGHI. And over the course of last year, I worked with the team to develop a global framework for cybersecurity scale up in healthcare. And I'll just spend the next 10 to 15 minutes going through the process and sort of why we did that and what the outcome was and where we're sort of intending to go next. So to start with a quick background that has actually been partly covered already by Saira and Deeph. We went into this project with the sort of basic understanding that cyber attacks on healthcare are increasing globally, and that poses a major risk to patient safety. As Saira pointed out, the first possibly attributable death to a cyber attack was recorded in September. And that's really given us a sort of new impetus to try and understand more the connection between cybersecurity and healthcare and how those two things can come together to make sure that patients are kept as safe as possible. And in the global context, health systems and providers around the world face challenges in building cyber resilience. That's largely due to financial and human resource constraints and other contextual factors. And so any tools that are developed at the global level really need to be sensitive to these contextual issues that will vary from context to context. So that's just what we were thinking about going into this project that was developed with the Leading Health Systems Network, a group of healthcare organizations interested in patient safety at Imperial College, along with the digital health team. And it was funded by the Qatar Foundation ahead of the World Innovation Summit for Health, which took place in November 2020. And as sort of mentioned, we were sure to get global participation to develop the evidence base on cyber incidents and response to attacks on healthcare organizations globally. And we did that sort of through a 3-step process, starting with assessing the state of cybersecurity in healthcare settings globally, partly through a literature review, followed by a survey on LHSN members who were sort of healthcare organizations in different health systems around the world. We then took the findings from that first experience and then developed a Delphi study where we asked experts on ICT, cybersecurity and healthcare policy from around the world what they felt was sort of critical in developing a cybersecurity framework for healthcare. And based on those responses, we were actually able to develop that. So just to give you a quick outline on the results of the initial baseline survey on the organizational landscape for cybersecurity, we did just a very small survey with organizations from 17 countries in 6 different regions to understand their organizational cybersecurity landscape and their level of cybersecurity. And so some just quick findings we got from that were that all institutions directly providing healthcare services use electronic health records in some capacity. And this was across the board, no matter a low, middle or high income country. So when we're talking about cybersecurity in healthcare, it really is a global issue because healthcare organizations are very much using electronic healthcare records, and they do hold health data in a very sort of substantial way. So within the sample, there was increasing frequency of cyber attacks reported across all institutions over the past 2 years. 56% of the organizations had experienced a cyber attack within the previous 12 months, which is actually likely to be sort of underreported. Of those who did report these cyber attacks, you can see from this chart here that there was a range of effects. I mean, some obviously were able to protect against the attack and did not have any sort of effect on their organization, but others resulted in cancelled patient appointments, impact on internal project progress as people were allocated to try and fix the issues that had arisen based on the cyber attack. Opportunity costs are an issue that were also reported, as were data loss and work systems just being down more generally. So talking about now the cybersecurity maturity measurement that we did as part of this work, you can see here that we tried to measure cybersecurity across 6 different spheres: governance, awareness, education, regulation, technology, and resilience. And these spheres are very kind of broad-reaching in terms of it's important to have good practices in place across each of them to have full sort of cybersecurity and resilience within an organization. So as you can see from this chart, regulation was the area that was the most strong in terms of maturity, whereas organizations were sort of less strong on awareness and education. So that kind of gives us an indication of where perhaps at the global level future work needs to really be targeted. We also looked at the differences in maturity across regions, and this is interesting and it really shows you a broad range of different scores across these different dimensions. As you can see here, the most mature scores came from organizations in the Western Pacific and Southeast Asian regions. But say, for example, the region of the Americas scored relatively highly overall, but struggled in the technology dimension, yet were extremely effective in the regulation dimension. So this just gives a sense of the sort of nuances that we need to be aware of when we're thinking about different elements of cybersecurity across different contexts. And that was a really interesting sort of baseline survey that we did to allow us to think more and frame our next element, which was the Delphi study, which is a method of gaining consensus on a particular topic among a group of experts. So we, as a team, got together and identified a range of people who were experts in cybersecurity, ICT, and health policy from various regions around the world. And it was very important to us to have as much international and diverse representation within that group. And 34 experts participated in the scoping round, where they were asked what are the most important components of a globally applicable cybersecurity framework. And at the end of that round, we identified 65 separate components as elements that the participants felt were important elements of cybersecurity framework for healthcare. So those would be, for example, firewall controls, training of staff, things like that. And we continued through the Delphi process to drill down through 2 more rounds, where we were finally able to reach consensus among the experts on 51 of those 65 components. And based on that, the Essential Cybersecurity for Healthcare Organizations ECHO framework was developed. And as you can see from the little chart here, we, as a research team, identified 6 overarching categories, which list all of these subcomponents. So that would be context, governance, organizational strategy, risk management, awareness, education and training, and technical capabilities. And so this framework kind of is a standalone tool, I suppose, that is designed to be either a minimum standard or an aspirational checklist, depending on an organization's resources and its cyber maturity. So we intend that this could be used by any healthcare organization around the world, regardless of sort of their financial capabilities, their human resource capabilities. It is designed to be as sort of guiding or as checklisty as one may require. So we published this report in November 2020 at the WISH Summit, and you can all find this full report online if you're interested. At the end of that report, we make 5 recommendations for the future, which are to include cybersecurity in the design and implementation of new technologies and systems, promote a globally validated and unified cybersecurity framework, develop and introduce practical context-based cybersecurity policies, engage with multilateral donors on cybersecurity as a critical element of digital health and patient safety, and finally, promote awareness, education, and training on cybersecurity. So these are things that as an organization, IGHI, we're going to be moving forward with. And we've identified some next steps for us as a department. And that will be, firstly, testing the ECHO cybersecurity framework to understand whether it can be implemented and is relevant in practice across healthcare organizations. And that will sort of allow for fine-tuning and expansion of the 51 components, as well as the development of additional tools to aid healthcare organizations work towards these components. And I think it's quite ripe to have tools around awareness and education for people in these healthcare organizations. We're very keen to engage with the global health community, including the WHO and multilateral donors, to advocate for cybersecurity to be considered one of the most challenging threats to patient safety today. And as a result of that, for financial resources to be earmarked to address this challenge. And finally, as Saira mentioned in her introduction, it's really essential that the global health community come together to agree a commonality of cybersecurity language, which very much already exists, but needs to be sort of embedded in our day-to-day discussions around cybersecurity for healthcare. And that will simplify the scale up within and between nations and regions, especially as cyber attacks become more complicated, more advanced, and they may affect multiple organizations and even multiple countries, depending on the level of severity. So I will stop there. Thank you very much. Pass back to you, Saira.
Thank you. And thank you so much, Nikki, for a brilliant presentation and going over all of the research work that's been happening. Just to start off, a question to you both. So obviously we've talked about a global perspective this time. And one of the things is that obviously the kind of big disparity between high, low and middle income countries is the kind of financial backing for any of these cybersecurity tools. And if either of you could, or both of you, could speak to how do you then actually bridge these huge disparities? Because actually there's talk of how low and middle income countries can essentially leapfrog some high income countries in terms of the technology and advancements in healthcare. But how do we make sure that cybersecurity is an integral part of any offering?
Yeah, sure. Nikki, you want to go first?
Yeah, I can do. So I think this is obviously very early days in terms of these discussions even being had, but I think there are certainly lessons that can be learned from how low and middle income countries are able to finance other elements of the health system. So the sort of more traditional approach is to reach out to donor organizations, multilateral organizations around the world, to see if they're willing to invest money in the scale up of these resources in individual countries. And I think there is certainly some value to that. But we also kind of need to be thinking beyond that model as donor transition and other elements of global health change and move forward and look to be more sustainable in the future. I think it's a conversation that, firstly, governments and in low and middle income countries really need to be having with themselves, with the ministers of health and the ministers of finance at the table to understand how much risk does cybersecurity pose, and therefore how much do they really need to be investing to ensure patient safety in this regard. And then I think there's also models around public-private investment engagement that could be considered to sort of allow initial seed money for healthcare organizations to scale up their cybersecurity while also working sort of with national regulators, etc., to ensure that everything is done in a sort of correct and scalable and sustainable way.
Yeah, would you like me if I can jump in quickly as well on that? I mean, I think the low-income countries, the thing is really fascinating. How do you secure those infrastructures? Of course, in some cases, there's not much infrastructure there, digital infrastructure. And so some of that security is built in by the fact because the cybersecurity issue becomes bad when you've got scaled up digital infrastructure. So in a weird way, that security is kind of baked in due to a lack of infrastructure in some cases. But in other cases as well, it's very important to realize that this is not just about technology, right? It's about people, processes, and education. And there are things you can do to get decent levels of cybersecurity just by making sure people behave in certain ways and treat these data assets and computing assets in a certain manner that, that has a sort of notion of cybersecurity behind it. In the future, of course, the problem is, I think, that those processes may not be able to scale as those digital infrastructures become more sophisticated. And the real issue is whether or not it's a bit of a false feeling of security at this moment in time for some of these countries, where they think, oh yeah, we don't have a big issue. But in reality, very rapidly, if they end up with a digital infrastructure, they will face significant cybersecurity issues, and it's being prepared for that and designing it into the system before you start building it, which I think is the real challenge. And that's maybe a compelling case to ensure there's investment in cybersecurity now. Yeah.
Thank you both. Just a reminder to everybody, please do use the chat function for any questions, or alternatively, if you use the hand icon as well, and it'd be great to have some of you ask some questions as well to both our presenters. But I might just go over to the chat function and questions that we had from Diego, who I think actually one of the others who have left the chat at the moment, is, do you know of any threats? Or, one of the things that we talked about earlier was the fact that COVID or the pandemic had certainly exacerbated the number of cyber attacks that were happening and various kind of different forms of cyber attacks. Do you think there's any risk to the track and trace system, and what should people potentially be worried about? I'm going to hand that to you, Deep.
Yeah, it's a very, very good question. The short answer is yes. Of course, there's risk around track and trace, and those kind of systems of there is always inherent risk in those things. And if data isn't handled properly, and if the system itself is not safe, and there's two things to worry about, right? There's the theft of data when we talk about cybersecurity, I suppose, and then there's also compromising the functionality of the system. Those are two slightly different things, right, that we might be able to do. And so, in both cases, it means you have to architect and design the system in such a manner that, of course, you deal with those kind of risks and threats, and that also you can change things in those sort of systems if a threat that you didn't really realize was going to be a threat suddenly manifests itself. The big problem, though, that you've seen with COVID-19, in my view, is a lack of transparency around the way in which the rollout and the architecture of the information systems was going to be put together in the first place. You didn't see enough exposure in the public around what was going to happen to data, who would have availability to that, all that sort of stuff. And that kind of mistrust is something you can deal with from the outset. But if you don't, then of course people's perceptions of cyber security on these platforms can be very, very skewed by just getting things wrong from the outset. And I think COVID has really exposed to people that, there are certain ways you can minimize people's risk perceptions, unwarranted risk perceptions in some cases, by making sure you get the rollout right.
I know it's a huge thing, isn't it? The trust element across any kind of data sharing, certainly security as well, that we've seen in some of the surveys that we've done at the Institute. Of EHRs or electronic health records and patients using online facilities for their healthcare now. That time and time again, this is a second survey that we've done, and the big thing that always comes out is trust and security are the two big issues, and what they perceive that people are doing with their data. But again, I think that's at the forefront of people's minds. Like you say, if you compromise that trust, or certainly if you're not demonstrating trustworthiness from the outset, then it becomes very difficult to backtrack. Yeah,
and I think that's again, sorry to jump in there quickly again, but you'll see in other software domains, people have made the choice, for example, to publish their source code from the outset to demonstrate transparency and ask people to basically test and examine what they're doing. That is a very powerful thing to do, because you're likely to make a mistake anyway. Something may happen to you further down the line, but what you want the users to think is actually you tried your best in the first instance, and this was kind of out of your control, and that kind of maintains trust. It means that the trust is resilient. What you don't want to do is, again, have people not really sure about you using the system, and then something goes wrong, and then retrospectively they go, oh yeah, of course I shouldn't have trusted that system. They weren't transparent or open in the first place. And then you see a mass migration off these kind of platforms. You'll see a big download of Signal over the last few days as people are shifting from WhatsApp onto Signal. There's a massive download happening. I mean, people have been moving over that to Signal for the last few years, but that's a data and trust issue because of the Facebook WhatsApp connection. There's a big move over to Signal, just happening in the last couple of days. So,
just to input a little bit on the sort of this issue of data and trust in the sort of LMIC context, I think again there's a lot of examples to point to about really how you have to be so careful with data and how mishandling it can really erode trust in the system. I think the two major examples that come to mind, and actually the most recent example would be in Sierra Leone during the Ebola pandemic. A lot of NGOs came in country to assist with the handling of that, took a lot of data, collected a lot of samples from local populations, and went back to their own countries with that data and with that information. And there's a real lack of trust in a lot of LMIC countries around this idea that organizations, countries, foreign bodies are coming in and they're taking data, and no one can be sure what they're doing with that data and who really has the right to control it. So I think it's a very dangerous line that we walk down often when talking about patient data in this way.
Thank you both. I'm just going to go to the floor with this one. So if we, Ivy's put her hand up. So if I can ask you to get you to ask the question, please.
Yeah, thank you very much for a very insightful topic. My question is more around equipment. So we talked a lot about data, cybersecurity and stuff, but there are a lot of equipments used in the healthcare system, and obviously the technology hasn't quite caught up with cybersecurity. What would be your advice to sort of the NHS to start off with in terms of how to secure equipment that actually contain patient data or has, so for example, remote monitoring of patient data? A lot of these equipments can be, can be attacked by sort of cyber attacks. Do you have any thoughts on those?
Nikki, you want to go first this time?
I think I'll leave this one to you, given it's.
Yeah, if I get the question right, it's about the equipment that you kind of may already have and how to make that secure. And if you look at what happened with WannaCry and everything else, there's lots of lessons to be learned where maybe what can be done. Technology-wise, I'll be honest with you, from a technology perspective, there's no substitute for just updating the systems, right? Okay, for doing an examination of the systems that you have, looking at where the connectivities are between those systems, checking where data is stored, and having good, clear policies of how data is stored and moved. Those things can help a lot with the current technology that you have. However, you ultimately need to be able to say, well, I've got systems and I've got networks that are architected and upgraded to the point where they are cyber secure. There's little substitute for that on the technical side, I'm afraid. And I think all too often in numerous healthcare domains, you'll see very patchy kind of you'll see a very patchy picture in terms of, I guess, the modernity of the technical infrastructure. So, people will be using out-of-date operating systems over here and maybe very old computing platforms over there. There'll be people running around with, USB sticks in one place, but then there'll be another sophisticated network data transaction point over here. And the important thing is, because of interconnectivity, you're typically only as strong as the weakest point. So even though in this room over here, you might have this, fantastic new bit of technical kit, the likelihood is it suffers a vulnerability because of something else which is kind of old and outdated somewhere else. So unfortunately, the answer is investment and upgrade, I think.
And I think just even following on from that, even back to basics has been there's such a huge shift in the past year due to the pandemic of healthcare staff working from home. And it's those basic rules of like cyber hygiene, it's kind of, making sure you're on a secure network, making sure that everything's password protected, making sure that you're using a work device to access hospital systems from home. So it's all kind of really basic things like that. I think we just need to actually even get those right before going on to the kind of next level. And it's that back to the education piece again for all staff.
Yeah, and I think if you enable workflows using well-constructed tools, that helps a lot too. Because, if you've got clunky tools, if you've got things that require me to move data in ways which are, let's not say, cyber secure, then it's just going to happen, isn't it? And I think all too often what happens is that we don't necessarily have the kind of the correct data tools and the most up-to-date or user-friendly data tools, and under pressure, which of course you get in healthcare systems, and under stress, and just because of the time imperative to get things done, sometimes the last thing people are thinking about is whether or not what they're doing is cyber secure. They need to get something more critical done, more time critical done. And if you've got tools that don't allow that to happen easily, then of course there will be problems, right?
Absolutely. And I think just picking up on that point, there's a couple of questions on the chat thread. And one of them is, should the makers and proprietors of software be more responsible for offering cybersecurity? And as a second part to the question, anything that we can do in terms of design for cybersecurity, in terms of kind of encouraging people or making it easier for people to comply with security using these different pieces of software?
I have a strong view on this, but Nikki, go on.
Okay, yeah, I think I would say that yes, very important to more responsibility among the developers themselves, but that alone is not going to create extremely secure cyber system. You really need to have buy-in at all levels across the health system and the organization itself. And the organization itself is as strong as its weakest link. So everyone using that software really does need to be engaged with cybersecurity, and they need to understand what they can do to keep the whatever data and whatever information they have safe. So I think that's all I'll say on that.
Yeah, I mean, just to pick that up, I agree. So there's a responsibility on the manufacturers to do this kind of stuff and to make it secure. However, on the other side, it's a buyer beware type argument, right? Putting my business school hat on. If you're in procurement and you're procuring technology and you are specifying it, you have got to be able to put those kind of requirements into those tenders and into those requirements. So there is a big responsibility from the user to actually demand cybersecurity as a feature within the products that they're trying to purchase. And at the moment, that doesn't necessarily always happen, right? So just saying to the market, listen, you need to produce secure systems is not great if it's not priced inside the product or put inside the requirements that you're going to get from the potential buyer. And this is important because quite often, what we want to do is to get manufacturers to make things secure by design, to create products which already have security built in. But that can take a bit more time and effort, right? Okay, so imagine, Saira, you're developing a product and I am too to solve the same problem, and we're racing to get to market, yeah? And I'm spending a little bit more time making it secure, and I miss the advantage to get to market first, and you manage to get there. That's the real competition that we're talking about. And if Nikki decides that actually she's more than happy to buy the piece of kit or whatever it is that you've made because you've delivered first, and cybersecurity, yeah, it's kind of not in the requirement, I'm done. It was a silly decision for me to go ahead and design my stuff to be cyber secure. That looks like a silly corporate decision or a development decision on my part. So it's a two-edged thing. There needs to be the demand for it, clear demand for it, and then you can see a response happening from the manufacturers community. At the moment, those demand statements are just not there, unfortunately. I would say, not the way they should be, anyway.
Mm-hmm. Yeah, and completely agree, and especially with the NHS and its purchasing power. You think that having something from the centre to almost demand certain cybersecurity basics to be inbuilt into whichever product that the NHS is procuring, you've kind of got that market force essentially.
Yeah, and it goes back to what Nikki said earlier on a little bit about the organisational knowledge, though, because you can't blame an organisation that doesn't necessarily have that base technical understanding of what the cybersecurity issues are, right? So if you don't have that across the organisation, maybe people just don't know what to write in terms of the requirement, right? So they're all interlinked, these issues, right?
Absolutely. So I'm very mindful of time, and we're coming towards the end. So one final question, and it was one that was asked right at the beginning. Are there any special cybersecurity risks associated with the likely future deployment of AI diagnostic devices?
Nikki, want to take that?
I think I will leave that one to you. I think we're quite a long way off AI being used largely in low and middle income countries, in health specifically. So yeah, I'll pass that one to you.
I mean, I think it's maybe a topic all on its own. The impact of AI and machine learning in healthcare cybersecurity, but in diagnostic systems, yeah, sure, there's lots of things that could go wrong. I mean, imagine, potential misdiagnosis, right? Or the kind of situation where somebody, deliberately circumvents those kinds of systems to create those misdiagnosis events. Now, if you've got networks of these kind of systems, you could end up with quite large-scale impacts from that sort of problem, or effectively just, poisoning the data that's being used to gather this information from these kind of systems, because the likelihood is that these diagnostic systems will gather data, make decisions, and that data will then feed into other algorithms and other systems later on. So you could end up with quite systemic issues from any deployment of AI and machine learning if you're not careful. But we're getting into stuff here which is, as I said, I think we can have a whole session on it. But short answer to the question is, yeah, I think great care needs to be taken when deploying any of these kind of machine learning tools in a health context.
Well, thank you so much. So now we really are nearing towards the end. So I'd like to thank our two speakers, Professor Chana and also Nikki, for their brilliant presentations and for taking part in the Q&A session. Thank you to Nikita and Justine for organising the event. So this, as I said before, this is a monthly I was going to say monthly show, but it's a monthly webinar now. And certainly it'd be great if you look out for next month's offering. So it's usually advertised on Twitter, and also lots of emails go around as well. So thank you so much, everybody, for joining us. It was a great session, and look forward to seeing you next time. Bye-bye.